Hi, I'm Serena Coates, and my report is going to be on melanoma. Melanoma is a type of skin cancer that originates in the melanocytes, sorry for the pronunciation, the pigment-producing cells of the skin. While it's less common than other forms of skin cancer, it is actually more dangerous due to its high metallistic potential. According to the American Cancer Society, awareness and early detection and diagnosis can greatly enhance your treatment outcomes. So if you see something that doesn't look right or changed, definitely get it checked out. We're going to go over the etiology, the demographics, the anatomy, physiology and symptoms, diagnosis and treatments of melanoma, and hopefully get a little better understanding of what it is and how to prevent it. Melanoma develops due to a combination of genetic mutations and environmental factors. Genetic mutations are genes such as the NRAS, CDKN2A, and the BARF, as I like to say, BRAF. They contribute to uncontrolled melanocyte. It pretty much kind of does things to the melanin in your skin. Different types of environmental factors, the UV radiation from excessive sun exposure, tanning beds, frequent sunburns, all those types of things give you a higher risk of melanoma. They originated from the melanocytes, which produce melanin to protect the skin from the UV damage. So individuals who engage in frequent sun exposure, if you're going tanning and you don't put tanning lotion on, of course you're going to get higher risk of developing it. So the behavioral risks are kind of easier to control than the necessarily genetic mutations or the environmental factors. So when dealing with melanoma, you want to be cautious and do the things that you can do to help yourself to lower your risk. Demographics of melanoma risks vary across different populations. The higher risk, of course, Caucasians with lighter skin tones. You probably notice people with red hair have lighter skin tones, and they don't have as much melanin in their skin to help protect from the UV light, so it takes a lot more awareness to lower your risk when you have a lighter skin tone. The lower risk of getting melanin, Asian and Hispanic cultures, it's very shocking that Black, non-Hispanic has a higher risk, but usually from the CDC it states that Hispanic and Asian cultures or ethnic backgrounds tend to have a lower risk. They're still successful about it. They can get it, but they usually have a darker skin tone. I know depending on what part or what ethnicity of an Asian descent, because some are darker than others, so it kind of bases on skin tone. Age is a big factor as well. People over 50, of course, you've had more exposure as you get older, so the older you get, the more risk you have in getting melanoma. I'm going to break down first the anatomy of the skin. The skin has 3 different layers: the epidermis, which is the outermost layer, and that's where the cancer cells are mostly found; the dermis, which contains the blood vessel, the hair follicles, and the glands; and the hypodermis, which is the deepest layer. It consists of the fat, the connective tissues, various types of that connects everything together. The we're going to go over the cellular structure. Normal produce melanin that protects the UV against UV damage. And then, of course, there's the DNA mutations, the BARF and RAS, the CDKNA, causes the uncontrolled cells that form the tumors. And it normally happens in various stages. We have the first one, the radial growth, which the radial growth is the early stages of melanoma, and it spreads within the epidermis in the early stages. The vertical growth, this is where it can go deeper into the layer of the dermis, and it can affect the blood vessels, your hair follicles, your glands. If it gets to the metastatic stage, the melanoma spreads through the lymph node systems, the bloodstream, leading to various other types of issues. It can spread to different types of cancers and affect different organs in the body. So once melanoma progresses beyond the first layer, it starts to cause much more damage. So the minute you find it, if you can catch it soon enough, and usually that's where it is, that's the reason why it is so easy to survive this type of cancer. Here, the melanocytes, I still cannot pronounce that word for anything, produce melanin, which absorbs and distributes the UV radiation to protect the skin. When the malignant transformation happens, it multiplies continuously, forming tumors, and that's when we start seeing the mole or whatever it is start to spread or to get bigger or maybe grow hair, or it changes in some way. The ABC rule helps identify early stages of melanoma. A, asymmetrical, uneven shapes or structures of what it is that you're looking for. The border integrity, is it jagged or is it unclear edges? Does it keep, going? Is it a nice clear shape or is it unclear? Color variations, different shades of brown, black, other different, like tones or hues. The diameter, does it exceed 6 millimeters? Is it growing? Is it staying the same? These are the things that you need to ask yourself. The evolution, changes in size, shape, color over time. If any of that happens, you want to be noted and understand that that is a sign. It can itch or bleed. If you have advanced stages, it can affect your health in other ways: weight loss, fatigue, hair loss, just a various upset stomachs, things like that. It affects a lot more than just your skin after it gets to a certain point. To confirm melanoma, medical professionals use a variety type of medical tests and procedures. Dermoscopic examination, a non-invasive skin assessment. They can just kind of look at it. They look, see what it is, check the size, the color, the variations. They could do a biopsy, which is taking a little piece, sampling the suspicious tissue. They cut a little piece off. Usually they'll just, depending on the biopsy, if they could scrape it, it's okay. Otherwise, sometimes they have to numb you in a certain area and cut it out. And then they send it off to a lab for testing. If it gets too big or too bad, or it goes deep, they could do imaging just to see how it is, how deep it does go down, if it's affecting anything else. They use CT scans, MRIs, PET scans. This all can detect the metastatic part of the tumor itself. There's various treatment options depending on what stages you're at. There's surgical, removing the tumor and the surrounding tissues. There's immunotherapy, which is boosting the body's immune response to fight out the cancer. Targeted therapy, using drugs that specifically attack melanoma-related genetic mutations. There's also chemotherapy and radiation for the more robust types, or, you know, at the time, if you have it, it's more spread or anything like that. And in advanced cases, they want to control the tumor spread. So if it's spreading very high, then that's when they'll use chemotherapy or radiation. It's not used at all the time because chemotherapy and radiation does affect other portions of your body, other tissues. So they like to use that as a last resort, only if it's starting to spread other places or it's growing rapidly. That would be one of the more last types of treatments that they would like to use. So while melanoma is a serious condition, it is both preventable and treatable when detected early. Prevention strategies such as using sunscreen, avoiding excessive UV exposures, and conducting regular skin checks can lower your risk totally. The best defense is awareness. Early detection and prompt medical condition. Like I said, always wear sunscreen. Try to stay out of the tanning beds. I know that glow is like the new beauty standards, but you can get that glow with sunless tanning creams and things like that. You do not have to put yourself in UV lights. I know most people in this class are a lot younger than I am, and also that UV does a very big toll with wrinkles and sunspots and other variations maybe that don't necessarily lead to melanoma. But if you're young enough and you protect your skin, the better off in the long run. As you age, your skin will be there to help you out. Here we have a list of references of some of the information that I've gotten from the cancer website, CDC, National Institute of Health. They have lots of different statistics on there on how and why, but for this short presentation, I didn't want to get too in depth, but you're more than welcome to read on your own for more. Thank you.